explain a little bit about. Oh, there we go. Going to do my very best to explain a little bit about NVT. For those that don't know, my background was mechanical engineering, and to cut a very long story short, I was an engineer with a shoulder problem. Typical man, I put up with it for several years before I decided to try and get it looked at. And eventually I ended up going, despite seeing physios, chiropractors, osteopaths, I got referred to the hospital. I had 18 months of physio there. And in the end, they couldn't find out what was causing my acute pain in the shoulder and complete muscle loss on this right side. So what I was offered was two options. I was offered an exploratory surgery, basically cut me open and have a look. And that didn't really resonate because we'd had the scans and the x-rays and nothing had shown. So my engineering mind said, well, if you can't find what you're going in there for, you might make it worse. So I politely declined. And plan B was cortisone injections every 3 to 6 months, depending on when I needed it. Now, again, I politely declined because my engineering mind said, well, surely I didn't know much about the body at the time, but the pain was surely my body's way of saying something wasn't quite right. Sorry, guys, if anyone's got their, if we could all mute just for a couple of minutes, lovely, that's great. Thank you very much. We'll make sure we've got plenty of time for Q&A at the end.
I think
so. Sorry, just,
I think you can also, if you're the host, you can actually mute people, because I think Sandra said she couldn't mute herself. So maybe whoever's the host can try to mute the rest of the people.
Gail is very kindly in charge of that, so I'll leave that in her capable hands. Thank you. So yeah, again, I politely declined the offer of the cortisone injections because for me the pain was my body's way of saying something wasn't quite right, like a flashing red light on the car dashboard. So basically I'd exhausted all medical options, but I learned a valuable lesson, an invaluable one, which was basically there was no pathology involved or no identifiable pathology. So that was very key. And again, today, for example, if I was to see someone with acute long-standing migraines, I want that person to have had MRI, CT scan, etc., to rule out any pathology first, because obviously if there's a cancer or a tumor or any pathology, then that person may need medical intervention first. That's very, very important. So I want to stress right at the very beginning here that these engineering concepts are not in any way, shape or form alternative. For me, I would classify my work as complementary. And I'm very fortunate where I work in Jersey or where I was working in Jersey, that we built up very good relationships with the medical community there based on 22 years of helping people. I worked alongside the hospital consultants, many GPs, based purely on the results we got. So my work is complementary in the sense of I see it working together with the wonderful things that modern medicine can offer. But certainly from an engineering perspective, I think that modern medicine has two main failings. I think firstly, it very often treats the symptom and not the root cause. And secondly, I think diagnostically, we can be a little bit limited in our diagnostic skills. For example, you can really only work with what you can see, with a possible exception of physio. So if nothing shows, if someone has a presenting condition and nothing shows on scans, x-rays or blood tests, then how can you actually formulate an evidence-based treatment program? You need to find something wrong. So if you can't find anything wrong, if all the tests come back okay, it's very difficult to formulate an evidence-based treatment program. And it can very often become a little bit like pin the tail on the donkey based on, the skills of the individual clinician and their interpretation of the symptoms on that given day. So for me, that's not really accurate enough. As an engineer, I was taught to look at an imbalance, make an accurate assessment of the root cause and address it accordingly. And it's those engineering principles that I've tried to bring into my approach to bodywork. So really, when I'd exhausted the medical route with my own shoulder, I was like, well, hey, what do I do now? I've been seeing chiropractors, physios, osteopaths, a whole spectrum of healthcare professionals. And for me, it was the same pattern. Whoever I saw, 2 days, I was pain-free. By the third day, the pain was back. It was the same pattern time and time again. Well, basically, I learned to live with it. I got on with life the best I could. I had 3 young kids at the time and family to support. So I just did what I did. I was running the engineering company you just become a robot, basically, try to get through from one day to the other. So my mother-in-law at the time had suffered from fibromyalgia many, many years. And again, all the tests come back. Gail, I don't know if you can hear us there. I think it's Anna. That if we can mute Anna, there we go. Perfect. Thank you. Sorry, Anna, don't take that personally. So yeah, I went to see a guy who had successfully treated my mother-in-law when, again, medically, all the tests had come back positive. She should have been absolutely fine, but some days she could not get up off the sofa. She was washed out for days on end. So I went to see this guy because I basically exhausted all other avenues. And he was an ex-world powerlifting champion who'd got into bodywork because of his own injuries. So I'm lying there fully clothed on this inflatable airbed, and this huge guy, who was about 30 stone, was just making very, very light contact with various parts of my body. Now, I'd heard very positive reports. I'm very open to anything, and I trusted it implicitly. So something magical happened, one of those light bulb moments, one of those life-changing moments. After about half an hour, when he said to me, "What did you do to your ribs?" Now, he didn't ask me, had I done something to them? He asked me, what did I do? And basically, I'd broken 3 ribs in a martial arts tournament 10 years previous. And when he asked me, what did you do to your ribs? I know it sounds a bit corny, but it was like this light bulb came on inside my head, as if some part of me went, wow, someone's actually listening to what I'm presenting. So I wouldn't say there was any major fireworks. There was no hallelujah moments. There was no singing angels and all the rest of it. I just got off the bed about an hour later. Didn't feel significantly different, but I knew maybe at a subconscious level that something had changed. Now, the one thing I really liked about this guy's approach is all of the other people I'd been to see had tried to block book 10 sessions with me. The first question was always not why are you here or how can I help? It was always, have you got health insurance? Which I thought was a little strange. Now, sadly, I don't have health insurance. I didn't at the time. So, of course, I was paying for this myself. So when I got to the end of 10 sessions with some people, it was becoming a little bit financially depleting as well as demoralizing. So what this guy did when I finished at the end of the session, I said, Pete, do I need to come back? And he said, only if you feel you need to. And I was like, wow, that's different. So days went by, weeks went by. I would say that within 3 weeks, I was probably over 90% pain-free for the first time in 10 years. It was like a miracle. I was sleeping again. I felt 20 years younger. I had physical muscle growth that was visual. I'd completely lost my trapezius on the right-hand side. And within 3 weeks, the muscle was distinctly growing back again. It was life-changing for me. I was back in the dojo, back in the gym. I had my life back on track. So I did go to see him again about 2 months later. Now, I didn't need to. I felt on top of the world and I was pretty much pain-free. But I'm an engineer. I needed to know, how did you use these to identify the root cause of my problem when everybody else, without exception, had looked at the shoulder? Because that's where the pain was, but it was a referred pain. The root cause was the ribs, and this was the first guy to find it. So it changed my life so much that 3 months afterwards, I went to study acupressure. I did an acupressure workshop with him. And that was many, many years ago now. And for the last 22 years, I've been basically looking at the body from an engineering perspective and studying it with an engineering mindset. And I think one of the main differences with how I approach the body is many modalities will try to fix you or heal you. As an engineer, we're designed with a near perfect self-healing mechanism. Why would we try and fix a self-healing mechanism? There's no logic to that for me. If we had some skills, if we had some techniques, some assessments that we could develop that would enable us to identify not how to fix or repair someone, but to be able to identify where that person's self-healing mechanism was compromised, wow, wouldn't that be useful? And that's really what NVT is all about. Again, done 20,000 plus treatments now. I feel blessed to have that knowledge under my belt. And I used to work with bone. I used to work with muscle. I used to work with a wide spectrum of things that I was taught. And then as time went on and we started to get drawn to working with the more complex cases, all of this pretty much came down to one thing, which was the central nervous system. So from an engineering perspective, I view the central nervous system a bit like the fuse box at home. You know, if the circuit breaker trips, the lights are not going to work, the sockets are not going to come on. So if a part of the central nervous system is compromised, then very often, just like my shoulder, we can get drawn into treating the associated symptoms. What we need to do is go back to basics. Work with the first thing in line that could go wrong. Nerves control muscle, muscle controls skeleton, structure then governs function. So with the more complex cases, there's a lot of people here that I've connected with. I know there's a lot of people who are highly skilled professionals, but we all get stuck with people. We all come across people that don't respond as we would normally expect to our therapeutic interventions. And all I found, and the purpose that I've gone out for the first time in 22 years, this is the first time that I've actually promoted what I'm doing. All the years beforehand has always been from referrals and word of mouth. Never once have I promoted what I've done. I always prefer people to come to me when I believe that I'm ready and they're ready. But so many people have told me, Chris, you need to share this crazy stuff. This is so simple, and yet it works so well and so quick. You have to get it out there. So I basically went to Canada in 2018. I had this crazy theory, this engineering theory about post-traumatic stress. Why did 10 people experience the same event? 9 are okay, and yet 1 never fully recovers. It always fascinated me. So what I did a little bit more digging. I looked at the central nervous system. I studied the vagus nerves. And there was one thing that completely changed my therapeutic outlook. I was very successful. I had a busy practice in Jersey. But of course, not everyone was responding as hoped. I had a very high success rate with chronic cases, but there was always a few that wouldn't quite respond. And then I was reading a book by Stanley Rosenberg, Accessing the Healing Power of the Vagus Nerve. If nobody's read that book, I would strongly advise you to get it. Accessing the Healing Power of the Vagus Nerve, Stanley Rosenberg. It's a very small book. It's very, very simply written. There's no medical jargon in there, but it makes a lot of sense about the central nervous system. And I was flicking through Stanley's book. I'd actually connected with him because he contacted me after a post I put up on Facebook to do with children with ADHD. And he contacted me and said, hey, I work with a lot of these guys. I've been a therapist for 40 years. Maybe I can help you. And we connected quite a lot. He gave me some amazing pointers and actually asked me to proofread this book before it got published, which was a great honor. But I was reading Stanley's book, and there was one thing in there that just, again, bit corny, but it put the old light bulb on. And it was the ventral vagus nerve controls the top third of the esophagus. Now, that doesn't really sound like much, but all of a sudden, my engineering mind was going ba-bing, ba-bing. The dots were connecting. Because if the ventral vagus nerve was dysfunctional, then I knew to some extent that it controlled the signal to the heart and it affects the signal to the lungs. But what I didn't know was it controlled the top third of the pipe that carries the food and liquid down to our stomach. So from a purely mechanical and an engineering perspective, if the top third of the esophagus shortens, well, what's on the end? It's the stomach. So what's going to happen? The stomach's going to get elevated under the left ribs. And I'm sure there's many people here who will have heard of hiatus hernia. So what we have a big band of muscle that separates the heart and lungs from the digestive organs. And just off center on the left, and about 2/3 in, it's closer to the back of the body than it is the front, is a little opening in that muscle called the hiatus. So the hiatus fundamentally is a posh word for a hole. And what passes through there is the esophagus on its way through to the stomach. But also, when we look at the anatomy, we have 2 of our vagus nerves, part of our fight or flight mechanism. So if somebody was lying down on their back, it's a little bit like a sandwich. We have the left vagus nerve coming through the top, then we have the esophagus, and then we have the right vagus nerve coming through at the bottom. So my mind was, well, if I've got a shortening here and an elevation of the stomach, there's a high probability that one or both of those nerves will be compressed in the gut. And as I started to investigate with some of the people I was getting stuck with, almost without exception, that was a massive missing piece of my therapeutic jigsaw. I found that these guys had their vagus nerves jammed in the gut. So the way I like to explain NVT, and hopefully it's a simplistic way of doing it, is I like to look at a circle of dysfunction. Because when I worked with the military in 2018, what was intriguing for me was that even though they all had ventral vagus dysfunction, without fail, every single one of them. But when I looked at their history and I started to talk to these guys individually, what I found was not one single person had suffered one trauma that had caused this body to be locked in fight or flight. It was a cumulative effect. Every single person on this video call is a walking, talking library book of what we have been through in life, both physical and emotional. So the key word for me is unresolved. Trauma that we've suffered that remains unresolved. The body's not been able to process it. Now, usually in my own experience, of course, we suffer severe emotional trauma that can have a severe, long-lasting impact on us. But the harsh reality is, as a species, if we collapsed every time we suffered an emotional trauma, we wouldn't be here. But the body has a very, very profound way of working with emotional trauma. We don't forget, but it makes us stronger, enables us to move forwards. Tell me a mum that would have a second child if she remembered the trauma of the first birth. Yeah, not many. So the body has a way of processing trauma very, very well. So what I found when I was working with the military was these guys had suffered a multitude of physical traumas during the course of their life. Some of them would have been given an ADHD diagnosis, which is why they joined the military, to try and get some regiment in their lives and some focus and some discipline. So what I realized was a cumulative buildup of trauma eventually puts pressure on the central nervous system. So from a mechanical perspective, if we think about a tadpole-shaped balloon, it has a head and it has a body. The brain and the spinal cord fundamentally float inside this tadpole-shaped balloon. The bottom of the tadpole connects very strongly to your tailbone, your sacrum, and the head of the balloon molds very strongly to the inside of the skull plates. So this is a purely mechanical system, which is why I love this as an engineer. There's a part of the brain called the ventricular system. And what it does, it produces a fluid called cerebrospinal fluid to nourish and protect the central nervous system. So as this fluid is produced, there's a very subtle expansion of the membrane of the balloon. And because all the skull plates are molded to it, all of these plates have a specific anatomical range of movement. They fit together like cogs in a clock. And as they move apart, as the balloon expands, there's pressure receptors that say, hey guys, we've got enough fluid now. Sends a signal back to the ventricular system. That slows down the production of fluid. The fluid is then reabsorbed back into the blood supply. So what happens? The balloon begins to come together again. The plates move together and another signal says, hey guys, we need a bit more fluid. So in an adult, we have roughly 3 to 5 seconds of production, followed by 3 to 5 seconds of reabsorption. But here's the key. As body engineers, we can use this mechanical movement as a valuable diagnostic tool. So if the head is sitting properly on the top of the neck, then the base of the skull works like a swing. As the fluid is produced, the balloon expands, the base of the skull or the occiput rocks down towards the feet, and then during the reabsorption phase, it rocks back up towards the head. So just visualize a swing rocking backwards and forwards. Now, the body of the tadpole that's housing all the spinal nerves is anchored very strongly to that bone. So as the bone begins to rock backwards and forwards, it mechanically drags the tube up and down through the neck and the back. Now, of course, this tube is anchored to the tailbone, as we mentioned before. So in a healthy, functional central nervous system, if the mechanics are working correctly, we end up with a little bit like two ends of a swing boat, rocking backwards and forwards. The base of the skull and the tail will uniformly rock backwards and forwards. There is not one single person that you will come across who has a compromised central nervous system that will have a good mechanical flow, a good mechanical production and reabsorption of cerebrospinal fluid. So this takes me back to the circle of dysfunction. An event or combination of events, and very often, and this is something I'll hopefully touch on later, but birth is a big, big thing for us. I personally believe from 20,000 plus treatments and working with thousands of kids and babies, I think if we could treat every single newborn, if we lived in Nirvana and we had the capacity to treat every newborn, not only at birth, but every 6 months through to the age of 3, when most of the neurodevelopmental work is done, I think it would be a massive preventative and proactive tool that we could I firmly believe 60 to 70% of all the stuff I pick up in adults could be prevented if we treated them early in life. I firmly believe that. So let's go back to the circle of dysfunction. So an event or cumulative effect of events dislodges our head slightly on the top of the neck. Yeah. So what we have is, we spoke about all these bones fitting together like cogs in a clock. The base of the skull, the top end of our swing boat, it fits together with the bones behind the ears called temporal bones. And where these three bones meet, on either side, we have a little tunnel that's created called a foramina. And what passes through there is the blood supply draining from the brain back to the heart, and 3 of our 12 cranial nerves. Think of those as 12 main cables coming out of our fuse box. Cranial nerves 9, 10, and 11. Now, 10 is our friend, the vagus nerve. It's a real buzzword at the moment in many modalities. People are really beginning to realize the significance and importance of these guys. But here's the thing. As a body engineer, cranial nerve 11, the accessory nerve that runs parallel to it, gets forgotten about time and time and time again. So I think one of the big differences with NVT is that an event or combination of events dislodges the head on the top of the neck, and one or both of these foramina become compromised. So instantly what happens is the vagus nerve becomes compromised and the accessory nerve become compromised. So at that point, that person is stuck in some degree of fight or flight. So I like to visualize 3 things. I like to visualize the body in total balance. Let's call that 1. We have a natural healing state. The body's immune system and digestive system are working okay. Sorry, Gail. I don't know if you can shut Jane down a little bit. Or Jane, can you put yourself on mute if that's okay, darling? Lovely, thank you. So level 1, let's call that balance. Everything's working okay. The immune system, self-healing, digestion is all good. But then we perceive some kind of a threat. So as part of our survival mechanism, what the body's designed to do is to go from that level 1 to, let's call it fight or flight, level 2. So everything that's in level 1 goes on the back burner. The digestive system, the immune system, all of that is put to one side whilst we assess the threat. Because the reality is, if we don't survive the perceived threat, nothing else matters. So ancestral survival mechanism kicks in and say, hey, I've got a threat here, I need to deal with it. Now, if we can deal with a threat and we go back to a safe place, and that's very key, going back to a safe place, then we would revert from that level 2, that fight or flight state, back to a level 1. So sadly, in this crazy messed up world in which we live in, where we're all put under so much stress, we should, in a balanced body, be constantly flitting between 1 and 2. Yeah? But here we go. Our circle of dysfunction kicks in again. So an event or combination of events, I keep saying that because it becomes very, very pertinent for anyone that practices MVT or has experienced it. The head becomes dislodged on the top of the neck. These nerves become compromised and the body gets stuck in a level 2. Now that can happen from birth, a traumatic birth, a von Teuse or a forceps, cord around the neck. This could be compromised from our very first external breath. Yeah, there's no time scale to this. But if our birth was okay, but we've picked up a cumulative list of injuries as time's gone on. Maybe I had a few beers one night, fell on my backside, damaged my tailbone. Maybe I twisted my ankle running and the tendons got hyperextended and never fully restored themselves back to balance. So I had musculoskeletal problems. This cumulative effect has gradually dislodged my head on the top of the neck and compromised these nerves. So when this occurs, it's very important to understand we are now mechanically stuck in a level 2. The body wants to revert back to a level 1, but it can't because there's a mechanical component to the compromise. And to make that a little bit easier, I want you just to think of the analogy of we are nothing more complex than a bag of bones held together with elastic bands from a musculoskeletal perspective. Yeah. So some of these muscles are over tightening or some of them are too slack to compensate to keep us surviving. It's not ideal, but this is how the body adapts. So what happens is we are suddenly stuck in this level 2. We are treading water at that point. We're out in the Atlantic. We've got a life jacket on, but it's hard work. Yeah. We're going to bed with a clenched fist because remember the accessory nerve, I don't think I mentioned it earlier, but it does 2 very important roles. It controls the sternocleidomastoid and the big trapezius muscles. That's all it does. So anyone here who works with people, whether it's talking therapies or mechanical therapies, if you have someone that you've been stuck with for a little while, I'll pretty much guarantee that when you see them, they'll have two presenting conditions. One will be a slightly elevated shoulder on one side, because the accessory nerve, 24 hours a day, 7 days a week, is telling these muscles to tighten. And the second one is something called deviated uvula. So will someone remind me to talk about that at the end? Deviated uvula. I'll share that diagnostic test with you. So if you see any of your long-standing clients or patients with an elevated shoulder, you can pretty much guarantee they're stuck in that level 2. So what happens? The endocrine system begins to break down. The natural balance, the chemical balance in the body is changing because that person is stuck in a fight or flight state. They're looking for the line in the room. They're going to have ventral vagus dysfunction, which means they're going to have erratic heart function. And that is medically confirmed by something called high or low heart rate variability, which again, I'll touch on later. And it's going to have an impact on the lungs. Now, the effect on the lungs is there's nothing wrong with the lungs necessarily, but the signal is to put us in almost like a hibernation state. So the efficiency of the lungs is reduced. So, hey, if I've got reduced efficiency to my lungs and I've got erratic heart, what does that give me? Anxiety, instantly. So again, anyone who works with children, especially if you're a talking therapist, counselor, psychologist, psychiatrist, you will see a lot of the children that you work with will have open mouth. Their mouth will be open, because they cannot breathe properly in and out through the nose. So they're supplementing it through the mouth. Now, the big problem with that is that they're exhaling too much carbon dioxide. As crazy as that sounds, their oxygen levels will be okay whether they nose breathe or mouth breathe, but it's the exhaling of too much carbon dioxide through the mouth that does away with a lot of the foundational building blocks that our body needs to repair. But we can touch on that another day. That's a whole new subject. So when we're in level 2, again, it's important to understand the endocrine system isn't functioning. We're stuck in a fight or flight state. We will start to become hypersensitive to light, noise, taste, touch. We're always looking for the line in the room. So when we're in that state, and I'm looking now more at the chronic cases of post-traumatic stress, maybe someone who's been stuck in level 2 for many, many years will have a wide range of chronic medical illness as well. Hiatus hernia will be one of them. Then we can eventually find ourselves at level 3. This is at the more extreme end. Now, I've done a lot of work with the military. We've just completed a study for anyone that didn't fully keep up to speed with some of the stuff I was posting. We've just completed a clinical study with Lancashire University, helping the veterans with chronic PTSD. And we're just waiting on those results now, and I will publish those on LinkedIn. I'm very excited for that. But level 3 is what you will see with a lot of these guys. And for me, level 3 goes one of two ways. Either that person becomes like a boiling kettle. If you look at them the wrong way, if you say the wrong thing, they're just going to physically explode. They're quite aggressive. It's not great for them. It's not great for their loved ones. And many of these people actually live outside the family home because they're afraid of what they might do to their loved ones if they explode. It's not pleasant for anyone. I witnessed this in Canada on quite a severe level, and it was heartbreaking, and it actually led me to doing what I'm doing now. The other way that level 3 goes is completely the opposite. That person is hypersensitive to everything that's going on around them. Light, noise, taste, touch. So actually just being alive is a problem. So what they do is they survive by not being seen, not being heard, and they put themselves in a protective bubble. They disconnect and dissociate from the world. And again, that's really, really tough for their loved ones who might not understand that this is just a coping mechanism. It's how they're surviving. So the beauty for me with NVT and these techniques that we've developed over the years is that even though the body goes 1, 2, and finally level 3, by working directly with the central nervous system, by working directly with the vagus nerves and the hiatus and the esophagus, we can take the body from a 3 back to a 1. And we try to achieve that in our first session. And we have a very, very, very high success rate of achieving that. I would say over 90% within a 1.5 hour session. So to understand how we do that, let's go back to our friend, the circle of dysfunction. So we're stuck in level 2. We start to move towards a level 3. But of course, remember the top third of the esophagus has been shortening. So we've got the elevation of the stomach, and over time we will have a compression of one or both of the vagus nerves in the stomach. So I want to go just back one stage further, because remember, we've got compromised vagus nerve, we've got compromised accessory nerve. So not only is the neurology compromised when this head becomes dislodged on the top of the neck, but the entire musculoskeletal framework is also compromised because of the accessory nerve. That 24 hours a day, 7 days a week is tightening these two shoulder muscles. If you get many of your clients to lie flat on the bed, you will see they have a leg length discrepancy because one hip is shorter than the other, because the whole body on one side is elevated. Yeah. Work with a lot of sports people. Two of my kids were Great Britain athletes. A lot of the elite athletes that we treated had these problems. Let me go back to the circle of dysfunction. Yeah. So the last piece of the jigsaw, we're at level 2 or we're in level 3. We've got musculoskeletal problems. We've got pain syndromes. We've got a whole spectrum of physical manifestations, maybe even some pathology by this time. But the last piece of the circle of dysfunction, I always use the analogy of World's Strongest Man. And we've all seen these shows on TV where you've got these huge big guys pulling trucks. Yeah. If they get hold of the rope where it connects to the truck, you can pull and pull, but that truck is not going anywhere. But if you go to the other end of the rope and you lean in slowly, the truck starts to move. So using that same analogy, if I've got a pull on one or both of my vagus nerves in the gut, the truck in our case is the brainstem. So NVT is all about the fact that we've managed to identify that if the vagus nerve or nerves are compromised in the hiatus, then the effect on the brainstem suddenly becomes quite significant. So the central nervous system, the body has one last ditch attempt. It's already got compromised neck and shoulder muscles. So the only thing it can do to try and take pressure off the brainstem is to further tighten these already compromised muscles. And for me, that completes the circle of dysfunction. At that point, that person is pretty much 100% locked mechanically. So you can take them, put them on a beach in Barbados without a care in the world, beautiful scenery, beautiful day, lovely ice creams, but they are looking for the lion in the room. Yeah. When you're stuck in level 2 or 3, your focus goes inwards because the body knows that it's struggling. It's fighting an internal battle. Yeah. Imagine you've got a stone in your shoe. And again, you're on this beautiful beach in Barbados with this stunning scenery. But where's your focus? Your focus is going to be on the stone. What happens? You kick your flip-flop off, you get rid of the stone, and oh, wow. All of a sudden, you can start to see the world in a different way because the discomfort's gone. Your focus has changed. In my clinic in Jersey, I have a 7-meter wide by 3-meter tall picture of Mount Fuji on the wall in my clinic. And it will surprise you how many people come in. If they need a follow-up, say 3 to 4 weeks after the initial consultation, you'd be surprised how many people will come in and go, oh, wow, that's new. That wasn't there last time. Well, of course it was, but their focus was inwards. They never noticed it. So it's always a great sign when they go, wow, that looks amazing. When did you get that done? Because all of a sudden their interaction with the outside world has changed. So with NVT, my engineering theory was all about identifying this circle of dysfunction. And then I thought, well, if I just cut it into little chunks, if I can break it down into bite-sized chunks and make sure that they cannot anatomically link together again, then there's no reason why that central nervous system, why the autonomic state shouldn't refer and stay in a level 1, assuming that person doesn't have another major physical or emotional trauma. So basically what I did, I couldn't find anyone that could teach me techniques about the vagus, hiatus, esophagus. I was up ledger trained. I hadn't come across anything that really identified this at a mechanical level. So I got the Gray's Anatomy out. I trawled through the pages that were relevant, and I basically created techniques to release the vagus nerve from the point where it exits the base of the skull all the way down to the hiatus. And the last piece was always the hiatus. And I went to Canada. I was very excited. I trialed it in Jersey very successfully. And when I went to Canada and worked with the military, it just blew my mind. It exceeded all my expectations. So I was very, very lucky. after about 3 weeks after the, if anyone goes onto our website, newvisiontherapy.co.uk, there's a blog there and there's a little video that was taken when I was in Canada. And it's very, very close to my heart. I'm hoping to go back there in June or July next year to carry on the work. But I was contacted by somebody from within the military who said, wow, what did you do to our guys? We can't believe the difference after one session with no counseling and no medication. They were just blown away. So I got invited to Gagetown, which was the biggest military base in Canada on the East Coast. And I was able to do seminars for the neurologists and the medics on base and explain these very, very simple concepts. And it was always the same feedback. Firstly, it was like, but this is so simple. Wow, why aren't we taught this? And the second one is, if it's that simple, where's the catch? Well, I haven't found one yet. And I know there's a few practitioners of NVT here. I don't know if you guys have come across a catch, but I haven't found one. I think just through a combination of an engineering mindset, I think the big benefit that possibly I've had is I was not medically trained. So when I started to take this knowledge on board, I had a blank piece of paper. I had an engineering mindset. I looked at the body. I identified very early on that why would I fix a self-healing mechanism? There was no logic for that. But what we could do is identify where it was compromised so that we could restore the capacity for self-healing. And really, that's what NVT is all about. We created protocols, techniques to release the vagus nerves, identify using the mechanics of the central nervous system that we spoke of earlier, and also something called fascia. Fascia is probably our second most valuable diagnostic tool, which I think, including the mechanics of the central nervous system, probably sets us apart from some of the amazing thing that modern medicine can offer. So fascia, I'd like you to visualize that as a spider's web. Nothing more complex than a spider's web. It's a very thin layer of connective tissue that permeates the entire body. It separates muscle from ligament, from organ, from bone, from tendon. So if I tap a spider's web, I send a ripple through the whole web, yeah? But if I put my finger into the web and I gently rotate it, what happens? The web wraps around my finger. So when we look at the web, there's a big distortion where my finger is. As I move away from my finger, the effect on the web becomes less and less. But even at the outer extremities, it is still a little bit compromised. Yeah? So the distortion in the web, what is that in real life terms? Well, it's injuries, trauma. I use the word unresolved trauma. If I twist my ankle and over time it heals, it's not relevant. It doesn't matter. But if I never fully go back to 50-50 load bearing, because maybe the ankle never fully heals, and I go back to 60-40, then that's going to have an impact on my musculoskeletal framework. And eventually, we spoke about the cumulative effect of stuff that we've all picked up in life, and we continue to do so, until eventually this cumulative effect of musculoskeletal imbalances tips the body. So a seemingly innocuous event one day will be the straw that breaks the camel's back, and that person gets locked in this mechanical state of fight or flight. So NVT really is all about looking at this from an engineering perspective, having a very simple diagnostic tool. In fact, I would probably say we have two that are medically accepted, because I didn't come down from planet Gaga on the last ferry boat. I'm a very grounded person. I have to understand what I'm doing, and I want to be able to explain it to the medical community in a way that they understand. Now, they still probably don't know how we can achieve it using just these, but the science is very, very clear and very distinct. So there's two diagnostic tools that we can use. Have an understanding that every single unresolved trauma that I suffer as a human being will put a twist somewhere in my fascial web. Yeah, without exception, every single one. So over time, I pick up these fascial traumas, twists in the web. Now, to understand where I'm coming from, I want to go right back to the beginning. At conception, when sperm fertilizes egg, a shaft of light is created. It's visible under microscope. And that shaft of light goes on to become the central nervous system. It goes on to become the brain and the spinal cord. So for anyone here that, I know we've got a few of the NVT guys here tonight, thank you. You will hear me talk consistently about the importance and the significance of the midline. The midline, as we grow and develop from conception onwards, at conception, the shaft of light is created, but also we have, for me, a blueprint, a DNA blueprint is created, a set of plans that enables us to grow, develop, and self-heal. Very, very important. Yeah. So as our body grows and develops, up to the age of about 19, when the skeleton is fully set, then this blueprint is always using the midline of the body as an organizing fulcrum around which to self-heal. That becomes very, very important. If our midline is physically compromised, we will lose the ability to some degree to self-heal. And again, at that point, we can argue it suddenly becomes treating symptoms instead of root cause. Yeah. So NVT is all about restoring the mechanics that we spoke of earlier, the mechanics of the midline, getting the cerebrospinal fluid being produced in the right volume and amplitude. Because I want you to visualize this balloon that we spoke of at the very beginning. If I have a few twists in my web, in my fascial web, then those twists are physically applying pressure to the midline. Yeah. So remember what's happening. This balloon that's housing the brain and the spinal cord, it wants to expand and it wants to contract based on the pressure receptors in the skull plates. Now, if I've got a balloon, it's a pressurized vessel, yeah? So I can squeeze a balloon anywhere along its length, and I'm going to create pressure through the whole of the mechanism. Agreed? So if I've got a combination of unresolved physical traumas, eventually one day what's going to happen is there will be so much pressure applied to this balloon on the midline that one of these days it's going to expand and it wants to contract, but it can't because there's an external force or forces applied to it. This is pure mechanics and physics. So what happens is, depending on the fluid produced or reabsorbed, at one of the two extremes, either in the reabsorption phase or in the full expansion phase, the system will become mechanically locked. The reason it gets stuck at one or the other is if I've got a truck and this truck has a very powerful engine, once that truck's moving, it's very hard to stop. But once it's parked, if I get a couple of 6-inch blocks and throw it under the back wheels, it's very difficult for that truck to get the momentum to go. So during the mechanics of the central nervous system, as the fluid is produced and these bones are moving one way, it's like a pendulum. It goes all the way to one side, and then there's a brief stop, and then it comes back again. Then there's another brief stop, and it returns. So the stop at either end is the ideal time to chuck a block under the back wheel and jam the nervous system. And this is what happens when we have a cumulative buildup of unresolved physical trauma. It will eventually lock the central nervous system. And from that point onwards, we have lost the ability to self-heal. And from a clinical perspective, that person will show a whole wide spectrum of imbalances. And this takes me back to birth, unresolved birth trauma. How many kids, I don't know if there's people here that treat children or deal with neurodiversity. How many children with ADHD will fail the test I'm going to talk to you about now? It's the probably most valuable thing that I could give you to take away from tonight. It's a simple diagnostic test to confirm that that person has at least some mechanical degree of compromise affecting their central nervous system. Now, bearing in mind, if it's a child, 3 years old, 7 years old, 9 years old, they've still got a lot of physical growing to go. So their body is going to be growing in a compromised manner because there's already pressure applied to the central nervous system. So when we've finished this, you're all going to run to the bathroom, switch your bathroom mirror on, and have a look in the roof of the mouth for the uvula or tonsils. Okay? Now, above the tonsils, to the left and to the right, are two muscles called levator veli palatini muscles. And they're innervated by, you've got it, the ventral vagus branch, to be more precise, the pharyngeal branch of the ventral vagus nerve. So as a very simple engineering test, and this is actually a medical test, and I've asked many medics, why don't you use this test? And the feedback I have is, why would we use something we can't then treat? Why would we diagnose something that we cannot then treat? Which blows my mind, because if you can diagnose it, then surely eventually one day we'll get to the point where you can refer that individual to someone who has the tools in the toolbox to be able to help. But what we're looking for, you can get obviously if you've got an inspection torch, or you can get the light on the mobile phone, shine it into the roof of the mouth and have a look at the tonsils and the two muscles above it. Now, what you're looking for when that person goes, ah, there has to be a distinct make or break If it's a long drawn out ah, it's very difficult to see because every time they go ah, it sends a signal to these two muscles and they should lift. So ah, ah, ah. So in an ideal world, if these muscles are lifting symmetrically, then what the uvula will do, what the tonsils will do, is they will lift up and down in a straight line, like a puppet on two strings. Now, with a vast majority of the chronic cases that you people might already be treating, I will guarantee you that one of two things will happen. There will either be a noticeable deviation to one side, or if the palate is completely locked and all the nerves are jammed, you won't see any movement of the tonsils at all. Now, somebody might say, oh, yeah, but I've had my tonsils removed. They kept getting infected. So what am I going to do about that? Look at the two muscles in the roof of the mouth above where the tonsils were. What you will see, they're only small muscles, but they have a big, powerful range of movement for what are relatively small muscles. So if you notice that one muscle is distinctly moving more than the other one, then that again is your clinical confirmation. Yeah? So if the ventral vagus nerve is compromised, that person is stuck in either a level 2 or a level 3. Now, again, having had the benefit of done in over 20,000 treatments, I guarantee you if I walked into any special educational needs classroom anywhere in the UK or indeed anywhere in the world, and I had my little inspection torch and with parents' consent, and of course that's the beauty with this test is you don't even have to touch anyone. So there's no breach of anyone's code of ethics. But I'll guarantee you if I checked all of those kids, if they were all lined up, or I'm on the military parade ground and we've got these guys who are maybe signed off with suspected PTSD, I went along with the torch and checked. I guarantee you at least 9 out of 10 would fail the test. So we've got children coming into our system who are getting a diagnosis of ADHD or ADD or OCD. When you talk to the parents about the history, you will start to see a pattern that develops. And very often those young people will be the ones that had a difficult birth. They would have had a ventouse, forceps, cord round the neck. There would have been some trauma early on that from their very first external breath in this world, their body was already locked in a fight or flight state. Yeah? There will be a pattern for those that work with kids. If you work with adults, it's exactly the same, because if we've got a young child that is working through the system and struggling in school, struggling in early teen life, struggling in young adults, what do? We become a struggling adult. If the issue is not addressed at some point, we just get shoved through the system in the hope that it's just going to sort itself out. If you do this test, you'll be able to accurately confirm that person's central nervous system is mechanically compromised. And at that point, you can then begin to signpost them for some more specific treatment based on the diagnosis you've made. So there is another medical assessment that we can use, and that is very well accepted. It's called high or low heart rate variability. Yeah, so most people have got these smartwatches now. They can monitor if they exercise a lot. They're monitoring their own heart rate variability. Now, if we have something called low heart rate variability, it means our central nervous system is stuck. It's stuck in a fight or flight state. So we spoke about the ability, the adaptability of the central nervous system in an ideal world to be able to flip between levels 1 and 2, balance and fight or flight. Oh, I'm back in a safe place. I go back to a level 1. Now, if that's compromised, that person will have something called low heart rate variability. And it basically means that irrespective of the situation they find themselves in, their body is going to really struggle to adapt to the change in circumstances. Whether it's a safe place, a stressful situation, their body is mechanically locked, so it's hard to adapt. If someone has what's called high heart rate variability, then that is medically acknowledged as an indicator of health and vitality and well-being. So there's two very simple indicators that you can use as healthcare professionals. Obviously, the easy one is just to check for deviated uvula. Now, in many cases, you'll ask someone to open their mouth, you'll have a look at the tonsils or the uvula, and even without asking them to go, you will see a distinct deviation, even without asking them to make that. Sometimes it's at 90 degrees, it's wedged to the roof of the mouth. Yeah? Now, it's not as black and white as it's working or it isn't. Of course, there can be different degrees of dysfunction. Maybe the vagus nerve is 30% compromised, 50%, 80%. So there are varying degrees of dysfunction that you will see. But what's important to understand is even a small degree of compromise is going to have a negative impact on the balance function of the nervous system. So for me, it's not about fixing or healing people. It's about identifying why they can't fix and repair and heal themselves. So irrespective of someone's professional background, if somebody walks through the door and you do that assessment and they've either got compromised levator veli palatini muscles or the tonsils are deviating, then that person has lost the ability to self-heal. And all we're going to be able to do at that point is make a fight and manage the symptoms. So I'm very excited that over the years, we've been able to work with many of the psychologists, psychiatrists, talking therapies, physios, the mechanical guys, because again, once the nervous system has gone from that level 2 or that level 3 to, it's going to start to function much, much better. And as a talking therapist, the counselors come back to me time and time again. I'm working with a lovely lady in the moment up in Chesterfield. She was an NHS CBT psychologist. And on one of my recent trips, she gave me 7 of her most complex cases. She'd already started the training program, was blown away by it. But she said, I really want to see this in action. As a student, I want to see what this can actually achieve. So I went up to Chesterfield. She presented me with 7 of the most complex cases that she was working with, the guys that were not responding to the conventional tools. There was 1 adult and 6 kids. So after a week, we touched base. And I said, how are the guys doing? She went, well, yeah, there's a couple of small changes, but nothing major. And this is quite significant. Here's the thing. When somebody has an NVT treatment, because we're not trying to fix someone, we're simply restoring the capacity for the body to fix and repair itself. There are 3 stages to the recovery process. The first one is 3 to 5 days. Now, remember, we're not just working with the vagus nerve, we're working with the accessory nerve. So the whole musculoskeletal framework is going to change after a treatment. So what will happen is for 3 to 5 days after treating someone, they might get off the bed and say, but you didn't do anything. And that's how it should feel. The touch is very, very light, which I'll explain in a moment. But then for 3 to 5 days, they might feel like they've been a few rounds with Mike Tyson. Yeah, they're going to be achy, sore, tired. And they'll be like, but you didn't do anything. That will take phase 2, which is about 3 to 4 weeks to integrate. Now, the miracle for me is phase 3, which is 3.5 to 4 months. Now, I consider that, I call it a DNA cycle. So if we break an arm or a leg, for example, that bone will take 3.5 to 4 months to restore full integrity, to repair fully from the inside out. So after 3.5 to 4 months of us suffering a trauma, many parts of the body will have regenerated many times over. Bone is one of the last things. So if we suffer an injury or trauma, if after 3.5 to 4 months, we've not, for whatever reason, been able to fully resolve the issue, it's still unresolved, the body says, well, hey, I've had this window of opportunity to deal with this now. I now have to learn to live with it. So working with neuroscientists, my understanding is it actually alters our DNA. The compensatory patterns that we take on board in order to live with the consequences of unresolved trauma will directly change the DNA. The compensatory patterns now become normal. They become a part of us. So the flip side of that is if we're able to address the root cause to the best of our ability, I see it as a bit like pulling a thorn out. The body goes, that's better. Then automatically, the minute that person gets off the bed, their body is starting that 3.5 to 4 month cycle. So the miracle for me, even if we only do, people always ask me, what's the average amount of treatments with an MVT session? For me, the average, even with the most chronic cases, is probably 2, maybe 3 max, at 3-week intervals. Let's just presume I do 2 treatments. I see somebody, I do a follow-up maybe 3 weeks later, and then I say, look, everything's working okay. The fascia feels good. The swing boat's rocking and a rolling. That nervous system feels like it's doing its job. You need to now go through the 3.5 to 4 month cycle. And the miracle for me is the body has an opportunity at that point to revert back to the pre-traumatized DNA blueprint that was there at conception. It can start to work back to the original blueprint, maybe for the first time in a lifetime if it was birth related. Yeah. So if after 3.5 to 4 months, that person has experienced a 50, 80, 100% improvement in symptoms, the big thing for me is that they will not regress because the body has reprogrammed and forgotten the trauma was ever there in the first place. Yeah. The limbic system will have filed it as a memory, but that memory that we learn from, it makes us stronger and smarter, increases our survival mechanism, but it no longer is an open book on the table every day that haunts me. It was there, it's been dealt with, I've learned from it, boom, it's up on the top shelf now. Because every single one of us has one sole focus: survival. We are just trying to make it through to tomorrow. So that's probably our biggest asset, is the body is doing all of the work. And during an MVT session, it's very, very important to stress. What I'll touch on at the moment is a couple of things that, because a lot of people will say, what's the difference between MVT and craniosacral? So I qualified as a craniosacral upledger therapist, but I'm a firm believer that no one modality has all the answers, because if it did, we'd all be practicing it. That's the reality. So what I've done, I'm a bit of a thief. I've studied a lot of things over the last 20 years. Some of it resonated, some of it didn't. So I took a bit of this, I took a bit of that, studied a bit here, researched a bit there, and I've created NVT, which is as close as I can get. And it's developing and changing and advancing and evolving all the time, to what I consider the best available tool to deal with trauma, to help that body restore the capacity to self-heal. So one of the things that we use is something called the key and lock principle, which I know there's a few people here will be familiar with it. So when I was working with the veterans doing the study at Lancashire University, and for 10 years previous to that, I'd worked with the Royal British Legion in Jersey, helping the guys with chronic PTSD. One of the things that they talk about all the time is a deep-rooted fear of being re-traumatized. Now, obviously, there can be a huge benefit in talking through a trauma, but for some people, it might flip them back into a very dark place. So what we do with NVT is we take away the possibility of re-traumatizing that person, and the body is in charge of the entire process from start to finish. Because I don't think there's a mammal on this planet that will deliberately traumatize itself, because we're all just trying to survive. So by using something called the key and lock principle, and we have a very specific protocol that we use, we scan the body and it identifies very, very accurately where the body wants us to work, where there are twists in the spider's web that are impacting negatively on the balance function of the nervous system. But even if I get to an area that's compromised, I have to be conscious as a hands-on body worker that maybe that is there as part of a protective mechanism. Even though it's an area of dysfunction, it might actually be helping to keep that person alive. So who am I to just go in and override it by applying a greater force, for example? I think that's disrespectful. So I want to thank the body for identifying that, yes, there might be something going on, for example, with me with my right shoulder. But with the key and lock principle, what we do is we're able to drop into the depth of the spider's web. So we always have a working hand and a listening hand. So by dropping into the depth, that gives us a connection with the listening hand. It's like putting a key into the lock. I've got the right key for the right lock, but if I don't put it into the right depth, there's no chance that door's going to open. So by popping the key into the lock, by putting my hand into the depth, that gives me a connection with the listening hand. And the reality is that is on the surface, the very, very surface of the body. So when someone's lying in a clinical environment, they're lying on my couch, the clothing is an extension of the fascia, effectively. So as we begin to make contact with the clothing, there will be a sense of a connection with the listening hand. That's the body telling me that's the depth I want you to go. I've put the key into the lock. And then we adopt something a little bit out there, a little bit crazy, a little bit of quantum physics. We use the power of our mind to visualize a 12-hour clock. And this is where it gets a little bit wacky, and it sounds a little bit crazy, but I'm beginning to understand it scientifically as time goes on. But as I visualize a 12-hour clock around the working hand, your mind will get stuck at a certain point. It could be 1:30, 2:36, whatever it is. As your mind, and you'll question it because it's so subtle that you'll question it. People do this in workshop 1 all the time until they get it. You'll have 2 confirmations. First of all, there's a sense that your mind doesn't want to go past that point. And then secondly, there is a tightening between your 2 hands. The fascia will physically tighten. So you're getting 2 confirmations that we've put the key into the lock and we've turned the key to just the right angle that the body can start to unravel itself. This is very important. We feel something called a therapeutic pulse, and it's a three-stage process where muscles that are protecting a nerve or compromised nerves will release themselves based on the angle that we're holding the fascia. But the body's dictated the angle that it wanted to be held at. So the only reason the body was unable to self-heal beforehand is it needed that gentle mechanical barrier around which it could unravel. And this is why we're able to achieve so much. For an adult, a new adult client, I would allow an hour and a half to go through the whole body from top to toe. For a child, anyone under 18, I tend to allow an hour. And again, probably well over 90% of all of the people we treat, irrespective of how long the condition's been there, then we are able to deactivate that fight or flight state back to an autonomic state of balance within that first session. In extreme cases, if they've had a lot of physical trauma, maybe some surgery, there's some real twists in the web, it may take another session. But certainly the vast, vast majority, it's one session. So a lot of the veterans that we treated, the concern was that they were going to be re-traumatized, and it was a fascinating thing to experience. The feedback after the first sessions, a lot of the guys would say during the session or in the subsequent days after the session, what they would experience was some of them called it a vision or a memory or a flashback of just a comrade, a face that would just float past. And this occurred time and time again. But it wasn't some gory horror movie. It was just a happy, smiling face, as if to say, you know what, I'm okay. I'm okay. You can move on. And it was very reassuring for them. So not one single person during the clinical trial was re-traumatized by the work we did. In fact, it was the opposite. They all came back with a real sense of calm, a real sense that they could move forward. Friends, family noticed a massive, massive improvement. Did we do anything clever? No. The reality is we just used some simple engineering principles to accurately identify at the beginning of the process that the nervous system was mechanically compromised, and then we addressed it using simple hands-on skills. And that is really what NVT is all about. Did any of that make any sense? Well, maybe what we could do is, Gail, if you're okay, we can throw it open to a few Q&As.
Yeah, there is a couple of questions in the chat. I've been looking at it. Tanya said also more prone to gum disease when they breathe through the mouth.
Yeah.
Somebody did ask, Tanya asked again, how can we check for low heart rate variability?
Again, one of the easiest ways is a smartwatch if you have one. If not, there are plenty of devices on Amazon or some of the other sites that you can get something that clips on the end of the finger. This is what I used when I was working with the military in Canada, because they were able to see the bodies revert from low to heart rate variability during the course of the treatment. So they were getting clinical confirmation that that nervous system was changing within the space of an hour. So they're very cheap. It just clips on the end of the finger and it monitors either through a battery or through the internet. It monitors the data. And of course, you can sleep with it as well. So that a lot of people after an NVT treatment will want to monitor where they are. And I know we've got Stevie there in the background. Stevie's worked with obviously himself and a lot of elite sports people and noticed a big difference in the high and low heart rate variability after an NVT session, how the recovery is much quicker after intense exercise. So we're not dealing so much with the PTSD here. We're dealing with athletes and the body being able to recover after a treatment. So yeah, very, very important and a valuable diagnostic tool. It gives us another bridge of acceptability with the medical community when we have something that is a tool that they use to confirm that what we're doing actually, makes a difference.
Next question, do you have to do this in person or are there virtual options?
Okay, so yeah, I've worked on dogs in India and people in Mongolia and all sorts of distant work, and it does work. It really does. My personal preference is to get someone in on the couch. I don't think there's any substitute for that, because if the body is mechanically compromised, then it needs a mechanical intervention to some degree. So in the same way that many counsellors, I'm just going to let the dog out. 2 seconds.
Oh, is it your dog?
My dog. Right, one, out you go. Okay. She's heard something out there. Sorry. This is what happens when you do live TV. So yeah, my personal preference, I know that a lot of the counsellors I work with, the psychotherapists, etc., they understand that when they understand a bit more about the NVT and the mechanical concepts behind it, it's very, very difficult to talk away a mechanical restriction. If I've got a nail in my car tyre, it's very difficult to talk that out. I've got to get a pair of pliers, I've got to pull it out, fix the puncture, job done. So in the same way, I think that we can achieve a lot remotely by working remotely. And the idea for the future is once the guys have experienced, there's 5 basic levels to the workshop program. Once these people have got through to level 5, then it's going to be much easier for me to supplement a lot of stuff remotely because they already understand it. But I think certainly for me to try and explain level 1, and there's a few people here that will hopefully be attending a level 1 with us soon. For me to explain level 1 and get that real sensitivity of touch without physically being there, some of you guys have already gone to levels 1, 2, 3, 4, and 5. I think you'll probably agree it's very, very difficult for me to explain that to you without physically being there.
Touch is so important.
Yeah, I'm just trying to find the next.
While you find that, I'm going to let the dog back in.
Okay, no worries.
Okay.
Now, somebody was I can't find the message. Yeah, are you running training workshops in the UK? What is the process to? Wait a second. I'm going to lost it again.
To train to be able to do this.
That's it.
Okay, so
And it wasn't me.
yes, and yes. We are doing. I basically decided that instead of being sat in the clinic, as much as I absolutely adore my work, I feel blessed to do this every day. It's not work; it's just a blessing to be able to help people. But I felt that I've got a certain amount of knowledge now, and I wanted to share it with people. So I've decided to take 3 years out from being in the clinic and seeing 5, 6 people a day, and I was going to travel and teach, and we would run workshops with it wherever there was an interest. So we're coming to the end of the first year now. And we've got a very strong presence up in Preston. We've got a very strong presence with Joe, the psychologist, in Chesterfield. And we've got a base in the Southwest. I've got 2 clinics in Jersey. And we're just in January, we'll be setting up a centre of excellence in Tenerife in the Canary Islands. So there's probably 3 main areas that you'll be able to train. If we get the interest, we will consider doing a separate workshop. If somebody can get 8 or 10 people together, then we'll come in if we can, and we'll see you where you are. But predominantly at the moment, we've got our next workshops lined up in Jersey in January, but the next level 1 will be in Chesterfield on, I think it's going to be the weekend of the 15th and the 16th of February. That's the plan at the moment. That's the next level 1. So I just want to stress one thing, because a lot of people will say, well, this sounds great, but I'm not a body worker. I'm not a healthcare professional. And this is very, very important. When I was deeply impacted by what I experienced in Canada, and I saw how many families have been broken up by some of the guys that were suffering PTSD, both obviously male and female. So what I wanted to do was I spent 18 months with my insurer, FHT, making sure that anyone who wanted to start the NVT journey, they didn't have to be a body worker. They could work in the local corner shop. They could be a painter and decorator. They could be someone who works in finance or an office. They had no background in bodywork, but everyone is able to start at level 1 and they can go right the way through the qualification level. So if someone is an existing body worker and they have a level 3 of anatomy and physiology, then they can simply tag on NVT to what they already do. But if someone is not an existing body worker, they do a separate A&P, which we're just setting up at the moment, and they can get qualified and insured to practice. So a big part and parcel of what we're doing at the moment is we've got some veterans that we're training up through our charitable wing, because for me, the pinnacle of what we could achieve is maybe to get some veterans trained up to help fellow veterans. Maybe get some champions of, people who might be ex-addicts themselves or survivors of abuse, get those champions trained up to help other people in a similar situation. I think that's probably the peak of what we could achieve with NVT. So very, very important to stress that if anyone wants to start this journey, you do not have to be a body worker. It's open to anyone. In fact, I think it's easier if you're not, because you're starting with a blank piece of paper.
Next question. If you have a traumatic birth, will this follow you through with trauma through your life?
Well, of course, there's no straight answer to that because it depends on the degree of trauma. The body has an amazing ability to process and deal with trauma. But what I found over the years is a very high correlation of children that go on to develop special educational needs. And there's a very high proportion of those children that would have had what would have been deemed trauma at birth. Ventouse, forceps, cord around the neck, breech, even a natural delivery with no perceived trauma. The forces that we go through are extremely significant. I believe that we produce so much adrenaline to make it down the birth canal at birth that if we proportionately had the same amount of adrenaline in our body as adults, it would actually kill us. Yeah. So we've all been through that. So there is definitely a correlation between unresolved birth trauma and issues later on in life. There is absolutely no doubt about that. But depending on the trauma, the body may be able to unravel it itself. And indeed, many times it does, especially with ventouse. You see the babies born with a cone head. And many, many times these plates will just realign. And it's a miracle, really, how the body can do that. But sadly, sometimes it doesn't. These plates get jammed and then boom, that's it. That central nervous system is developing under pressure. So there's no yes or no to that. But again, if we lived in nirvana, if I had my kids again now, I would certainly advocate to all parents to get their babies treated at birth and then every 6 months up to the age of 3. Because certainly most of the neurodevelopmental work is done by the age of 3. And if you've got a healthy, functional 3-year-old, barring any major trauma later on in life, you're going to have a healthy, functional young adult, an adult. One other thing, just very quickly, if you're not sure, if you're an adult and you're not sure, maybe your mum said, yeah, you had a bit of a tough arrival, you're so-and-so. What are you going to do? You can check for deviated uvula. You can check if you have high or low heart rate variability. You can check if something in your history book has left you with a compromised nervous system. That's the value of those diagnostic tools. So I do have a little video that we've done. In fact, Dagmar, you were you were the student that very kindly did it with us. So I did a couple of videos just basically sharing how to assess for deviated uvula and also a very, very simple self-help technique, which Stanley shared with the world before he sadly passed. It's a very, very simple technique to do. You can do it a couple of minutes every day, but very, very powerful for mechanically popping the head back in the right place on the top of the neck and taking pressure off the vagus nerves.
Next question from Kate. Follow-up. Any US-based folks to refer them to then, or should we just send them folks your way virtually?
Sorry, any USB?
Any US-based?
Oh, US, sorry, US-based. Well, I'm hoping to go to Canada to carry on my work with the military there in June or July of next year, 2025. And if I've got the interest, I will definitely come over to the States. And it would be lovely to get a few people trained up there. Obviously, I know, for example, Gail, yourself, and a few others here come from a cranio background as well. So if there's somebody who is a cranio background already, I think they're halfway there at least. This is just adapting something they already know and maybe putting a slightly different tint on it. But definitely, if we have the interest in the US, we will definitely go over. It'd be great to have somebody take up the reins there. The goal that I have with NVT, I'm always on the lookout, obviously, to try and help as many people as we can. But the main thing I'm on the lookout for, because none of us are getting any younger, is I'm looking for people not only that I can teach the workshops to, so they can become practitioners of NVT, but ultimately I'm looking for teachers. Teach to teach. I'm looking for people who will ultimately go on and share this knowledge so that exponentially it can just keep expanding around the world. That's the way that I see we can help as many people as possible. And that's why I've taken myself out of the clinic for 3 years to try and find as many people as I can who want to walk with us.
Julie's asking, can you help somebody with cancer or with metal in the body due to accidents or operations? Or do you have to be very careful?
Okay, so I'll answer the second part first. If someone has metal from an injury, most of the time the metal is there to stabilize the vertebra because the discs are gone. If we're dealing with the spine itself, now what we're dealing with a tube. All of the bones in the neck and back, they stack up on top of one another and create a tunnel through which the spinal cord glides up and down if the mechanics are working. So most people who've had severe surgery like that, and I know yourself, Gail, Lee especially, you'll have treated many, many people with that condition. And if we can get the mechanics working again, there is always a profound improvement. I treated somebody just last week who'd had an operation in Germany, and he was pain-free after 2 days for the first time in 25 years. Didn't do anything clever. Just got the mechanics working again, and instantly, the pressure came off the nerves, the pain reduced, and it was dramatic. So if someone has a lot of steel work, it would not prevent me from treating someone, that's for sure. But again, we have to be realistic. We're not Jesus. Depending on what the severity of the trauma is, you may be limited in how much that web is going to release in a localized part of the body, because obviously there's something foreign that's in there. When it comes to cancer, and this is really interesting because I've been talking to a few people in Canada again recently about this. There's a real general consensus of opinion at the moment that cancer, there seems to be 2 genetic forms of cancer, and the general consensus at the moment in a lot of the professionals in the highest level in that field is that cancer is parasitic by nature. It's caused by parasites. Yeah. So if that's the case, again, from an engineering point of view, we know that cancer thrives in a high acidic environment. It needs hydrogen to feed off of. If we can create an environment in the body through nutrition, exercise, hydration, whether it's a high oxygen environment, it's a more alkaline environment, which brings us on to nutrition, supplementation, then we are reducing the risk that that pathology has got something to feed on. So there's 2 ways to look at it. With conventional approaches, chemotherapy, we're dropping an atomic bomb on the body. Effectively, we're killing the good as well as the bad. And I'm not saying there's not a place for that, but it seems a little bit drastic for me. Why would we not try and maybe starve the pathogen of what it needs? Would maybe make more sense. So I'm looking at the Rife technology at the moment, the old vibrational frequency technology. I think if you hit a parasite with 1150 hertz, it kills it instantly. In fact, I've got one here, a zapper. Some of you may have heard of these. You just strap it onto the wrist, plug it on for an hour and a half a day, sends a certain pulse into the body, and just neutralizes any parasites. So I think with cancer, again, we have to look at, there are many, many factors involved. A lot of them, I think, are lifestyle related. It's sad to talk about, but we're living in a polluted environment. Our water, our food, the air we're breathing is all polluted. So I think from cancer, which is on a significant increase worldwide, we need to look at doing parasite cleansers. We need to look at our food. We need to drink pure, filtered, fresh water. So would it stop me treating someone with cancer? Absolutely not. No problem at all. I would treat anyone, even with a stage 4 or 5. It wouldn't be a problem. I would dive in there and do the very best I could, because ultimately with MVT, we're going to be doing what the body is asking for. But I would be obviously working alongside that person's medical professional, finding out where they are, what kind of treatment they're on, and ideally looking at a parasite cleanse. Ivermectin is one which I know has got mixed reviews at the moment. I believe it's a very powerful tool. So again, I'm trying to get a protocol together at the moment that I can more advise people on that, because it's changing all the time. But I think the key factor is parasites.
Next question. Where can you access treatment? Is it only at your clinic in Jersey or online?
Okay, so the best thing to do is for someone who might be interested is just to ping me a message. So my email is chris@newvisiontherapy.co.uk. We're on LinkedIn, the website, www.newvisiontherapy.co.uk. There's lots of contact details there. Just ping me a message in the first instance. This is another reason why I've taken 3 years out, is because when we get the results of this clinical study, we're working with neuroscientists at the moment. We're hoping in the very near future to have pre and post brain scans of NVT to prove what's happening during a treatment, which parts of the brain are maybe calming down, which parts are being re-stimulated. So we're gaining a much more powerful evidence base as time goes on. It's not just me sitting in a room doing some crazy stuff. I know the difference it can make to people's lives. I know how quickly it works, and what we're going to do now in the next few years is get more of an evidence base. So at the moment, there are not many of us around. This is one of the reasons why I mentioned earlier, this is the first time in 22 years I've actively gone out and promoted my work, because I'm looking for people to become maybe students of NVT and eventually teachers of NVT, so we can spread this across the world. So at the moment, there are not many of us around. We've got Tanya in Spain. I'm in Tenerife and Jersey. We've got some amazing people spread across the UK, from Scotland all the way down to the southwest. We've got a couple of people in Portugal now. We'll be having a base in Madeira very shortly. One of the army medics I retrained from my experience with the military there. She left the military and is fully trained now in NVT. She's up in a place called Medicine Hat. So the thing to do, if you're not sure, please ping me a message. And if I can't find one of my guys in close proximity, then there's a good probability that I could guide you to a craniosacral therapist who would probably be the next in line. We could maybe have a chat with them and give them a couple of indicators to look for whilst they're treating you. And so we can definitely find someone. So please ping me a message and we'll do our very best to help.
Anybody else got any other questions?
No, I've bored you all to death. Well, there might be some questions that come up in the coming days. I know a lot of people here. Thank you so much for taking the time to join us. It means a lot. Obviously, there may be some questions that people don't want to ask here, so they're free to message me on LinkedIn or on email. So yes, if there's no other questions, then thank you so much for joining us. There's one other question I would just like to throw out, because I know we've got a couple of NVT practitioners here and some guys that are coming through the training program. So maybe is there someone here that's doing NVT that we just very, very briefly like to share their experience of the work?
Go on, Stevie.
Speak
Go
now,
for it.
forever hold your
Stephen.
peace.
Why did I know I was going to be the first one? This isn't my first rodeo talking in Zoom. That's probably why. So yeah, thanks, Chris. Really appreciate it. I hope everyone can understand me first and foremost. But my name's Stevie. I live up north in the hills and the mountains in Glasgow, and I was one of these guys that was a non-body worker. So I'd like to think I've got quite a good experience to share. Maybe some people can relate to that, because I really believe you need to be there. You need to feel it and see it and experience it. I mean, Chris has done an amazing job talking about what we do in the call tonight, but I remember sat in that room for the first time and Chris gave me a look, I gave him a look, thinking, I don't know if I can take more woo-woo in my life, but when I actually treated someone and I got the confirmation, all the things that Chris spoke about, my mind was totally blown. And to be treated myself, Rob, who's not on the call, and I know Chris has half treated me the last time we've seen each other. It's an amazing experience, and I've come on leaps and bounds. So, from a personal experience, guys, my heart rate variability has improved. My sleep has improved. Stress levels have come down. I don't know, somebody might track these. I'm quite mindful of it. Performance has went through the roof. I do CrossFit, functional fitness. I coach at a gym as well. I've competed in various competitions and I've definitely excelled. So that's the type of people that I'm looking to treat now, athletes that Chris mentioned there. So from a personal standpoint, it's absolutely incredible, and a really good book I'm reading at the minute I would recommend is called The Oxygen Advantage. I don't know if you've read it, Chris, but it speaks specifically about weak diaphragms, and some of the techniques that we do are so profound and amazing for helping us breathe a little bit better. So in the interests of just living a little bit better, of training a little bit better, I just think this is incredible. In terms of treating people, I've treated so many people already, and it ranges from stress, anxiety, performance-related issues, compensatory patterns. Some people are lacking in symmetry. It's just an incredible thing that's kind of just rolled itself into my life this year, and I'm really grateful to be part of the community and to be on this journey with Chris and everyone else that's on the call. It really is incredible, and I know some of you guys are so much more qualified than I am, and you just need to get involved with this because to give this back to the clients that you might have already it's a beautiful thing. You can really properly change lives with this. I genuinely believe that.
Thank you, Stevie. Thank you.
Welcome.
Lee,
I
would you?
think- Sorry.
Sorry, Lee. Would you like to say a few words? Lee used to be one of my teachers many years ago. Well,
Can't you
not
tell by
that
the
long
grey hair?
ago.
I think the other thing is, Chris, you mentioned about not having any training in any way, shape, or form, but if you're a good listener, you will go through the roof. Listening to what the body is telling you through your hands and then following it to me is the big key, because the body is telling you. You can't dictate to the body tells you, and you learn to listen. And it's just humbling and incredible and beautiful, and sort of there's a few times a patient has gone out and you've gone, oh God, because it's been just amazing. And you think, I need some of that. Where's the nearest therapist? Come and treat me. Just listen, and the rest will follow.
Yeah, the more and more somebody walks the NVT journey, they realize that less is more, and it really does become effortless. Yes, we have to learn the techniques initially. It's like, painting by numbers, but when you get it, Stevie touched on it earlier, it really does just become this magical dance, which is completely 100% governed by the body. I feel blessed to do it every day. Thank you, Lee.
Thank you. Thanks, Steve.
Okay. Anyone else like to chip in, or are we done for the night? I see.
Notice everybody
a bit
muted.
tired. Okay. Well, thank you very much, guys. I really, really do appreciate the time that you guys gave up tonight to come and join us. So I'm on LinkedIn. You've got my email address. The website with all the contact details is there. So anyone who has any questions, please feel free. If you'd like to do a one-to-one, or we can arrange another call on a one-to-one level, that would be no problem at all. And I promise I'll help answer any questions I have. And it would be great if some of you join the journey in the near future. So thanks very much indeed. Have a great rest of the evening, and we'll speak to you soon. Take care. Bye-bye.
Thank you. Bye.
Thank you for organising, Gail.